True compassion and assistance are impeded by the ongoing stigma associated with mental health in a world that is driven by advancement and comprehension. This video aims to address and dispel common misconceptions about mental health that fuel stigma. By dispelling these myths, we hope to promote a more knowledgeable and compassionate society in which people are willing to ask for assistance without worrying about being judged. It's time to dispel the misconceptions, combat the stigma, and cooperate to create a society in which mental health is valued as a vital component of overall well-being. Make sure to watch until the end because there is very interesting information for individuals who suffer from a mental disorder or have a family member affected by it and are experiencing the stigma associated with it. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. Myth: mental health issues are not very prevalent. Fact: mental health issues are widespread. In any given year, almost 1 in 5 persons will deal with a mental health issue. Serious mental health disorders affect 1 in every 25 people. These consist of schizophrenia, bipolar disorder, anxiety, and significant depression. Myth: mental health issues don't affect kids and teenagers. Fact: studies indicate that 1 in 5 youngsters suffer from or plan to suffer from a mental condition. Nearly a third of pupils had poor mental health in 2021, and over 4 out of 10 reported feeling depressed or gloomy all the time, according to the Centers for Disease Control. For half of adult mental health sufferers, the onset of symptoms occurred before the age of 14. Poor parenting is not the cause of these issues. They are a conglomeration of numerous elements. A lot of these things are out of the parents' or child's control. Adolescents and adults with mental health disorders may have experienced traumatic situations as children. Myth: those who struggle with mental illness are dangerous or violent. Fact: most individuals with mental illnesses do not behave violently. The Substance Abuse and Mental Health Services Administration estimates that only 3% to 5% of violent crimes are carried out by individuals who exhibit signs of mental illness. Indeed, the likelihood of becoming a victim of violence is 10 times higher for those with severe mental health disorders. Myth: having mental health issues indicates a lack of strength. Fact: mental disease is unrelated to strength or weakness. It is a medical condition that requires care, just like an infection, hypertension, or fractured bone do. You are not weak if you need help with a mental health issue. Mental health is influenced by numerous things, such as chemistry of the brain, injuries or illnesses, experience in life, and background in the family. Myth: people with mental health issues won't be able to overcome them for the rest of their life. They won't ever get better. Fact: mental health varies from person to person. It fluctuates during the course of your life. Feelings are influenced by a variety of things. Your mental health may alter if any of these variables change. Many of the issues you may experience throughout treatment may pass. You can overcome the issue and heal with the aid of a well-thought-out therapy plan. This does not imply that the issue has been resolved. However, you may learn to cope with it and continue to contribute positively to society. However, feeling better does not indicate a full recovery. Even after you start to feel better, you might need to stick to your treatment plan. Certain mental health issues never fully resolve. These are typically more severe illnesses like bipolar disorder or schizophrenia. However, some cases of anxiety and sadness are transient and disappear with treatment. Myth: time is wasted in therapy. Fact: therapy may not be to everyone's taste. They fear that they will have to return to their early years. However, contemporary therapy is intended to be brief. It centers on issues and their fixes. It is particularly effective in treating mental disorders, according to research. Usually, it works best when taken in conjunction with medication. Studies showed that when both were included in the treatment plan, between 70% and 90% of patients reported better symptoms. Myth: I am powerless to assist someone who is struggling with a mental health issue. Fact: there are numerous ways you can assist someone. Tell them you are available for them if they need you. Assist them in locating the necessary mental health services. Find out what they are experiencing. Show them some decency. Don't refer to them as mad. Show them your support in a language they can comprehend. Obtain assistance for yourself if necessary. Keep trying with them. Urge them to exercise and perhaps go on a walk with them. Myth: mental disease is unpreventable. Fact: mental health issues are not always preventable. However, there are risk factors that you or a loved one may address. Aim to reduce your exposure to trauma. Seek immediate assistance if you or a loved one is involved in a traumatic occurrence. Future problems that are worse can be avoided with early treatment. Lessen your tension. Your mental health may suffer if you lead a very stressful life at work or at home. Place oneself in uplifting circumstances. Steer clear of negative people. Instead, surround yourself with positive, healthy individuals. Form wholesome routines. Get plenty of rest, exercise, and eat a balanced diet. These simple self-care techniques have a big impact on your self-esteem and daily functioning. The stigma associated with mental illness keeps people from receiving the necessary support and assistance. They don't get treatment because they are worried about what other people would think of them. Their health frequently deteriorates. Sometimes people even commit themselves as a result of the stigma associated with mental illness preventing them from getting treatment. Keep an eye out for these indicators that you or a loved one might be exhibiting symptoms of mental illness. Sad or depressing feelings. Difficulty focusing. Extreme emotions, such as rage, fear, guilt, or despair. Elimination from social circles or pursuits. Severe mood swings. Abuse of drugs or alcohol. Inexplicable animosity or aggression. Unable to manage your emotions or stress. Hallucinations, such as hearing voices, or delusions. Considering causing harm to oneself or others. Never hesitate to seek for assistance. There is no reason to be ashamed or embarrassed about mental illness. Learning the facts and becoming aware of mental health concerns can benefit both you and other people. It even has the power to save lives. Questions to ask your physician. Some of these symptoms apply to me. Do I suffer from a mental illness? How is the illness being treated? Should I consult a psychiatrist? Do I require counseling? Could you suggest a therapist or counselor that I should see? Is this an ongoing issue or is it just temporary? Will I always require medical attention? How can I aid in my recovery at home? How can I communicate my mental health issues to others? By dispelling these misconceptions about mental health, we open the door to a society that is more understanding and compassionate and that acknowledges the humanity inherent in each person's path toward mental wellness. By dispersing stigma, encouraging candid dialogue, and disseminating factual information, we help create a society in which getting mental health treatment is a normal step toward overall well-being rather than a sign of disobedience. It's time to eradicate the stigma, accept empathy, and work together to build a society in which mental health is treated with the same consideration and care as all other aspects of our well-being. Now, check out this video to discover some helpful tips that will assist you in achieving a healthy lifestyle. Subscribe to the channel to receive regular health tips and advice. That's all for today, and always remember to stay healthy. Thanks for watching, and we'll see you in the next video.